Hello, everyone. Today we'll be introducing the Rigo Cheneau brace. The Rigo Cheneau brace is a custom-designed TLSO used for non-surgical treatment of mild to moderate adolescent idiopathic scoliosis of affected individuals aged 10 to 15 and have a Cobb angle measurement between 25 to 40 degrees. It's one of the most advanced options available, along with the Boston, Providence, and Charleston brace, which we have already detailed in class. This brace differs from the others as it uses a front strapping method, is worn for 15 to 23 hours a day, and has conformity to the body through advanced 3D scan fabrication methods, which we will detail later. The primary goal of this device is to minimize the progression of the scoliotic curve to a level where surgery is needed.
All right, I'm going to be talking about the technical details of the Rigo Cheneau TLSO. The primary thing that stands out about this brace is that it addresses the 3D nature of scoliosis by using CAD or CAM technology. This stands for computer aided design or computer aided manufacturing, and it replaces the traditional plaster process by using 3D optical lasers instead to get a more detailed scan of the patient's torso. This brace is really unique and innovative in that it applies both detorsional forces and 3-point pressure systems to improve spinal alignment in all three dimensions. This brace utilizes a selective pressure system to apply pressure only to areas that are requiring correction by using pads that are designed and oriented in a highly specific manner to bring the patient into the best possible three-dimensional correction. In areas that don't require correction, there will be some hollows or relief areas built into the brace in order to encourage movement and shifting, as well as more comfortable chest expansion for breathing. This brace is pretty low profile and it's also very easy to put on. Now, on this slide in the photo on the right, you can see an example of the relief areas that I was talking about on the previous slide. This again allows for the brace to be a little bit more comfortable, and it can also have a cooling effect because there are various openings in the brace where the patient does not need any pressure applied or any corrections to be made. You'll also notice that the front of the brace is cut or made to be a little bit lower than the back, and that allows for chest expansion when the individual is breathing. And because this is a low profile brace, the patient can actually wear the brace under their shirt rather than having to put it on over top of their shirt.
Next, we're going to be talking about benefits that the patient can expect from wearing the Rigo Cheneau brace. So based on about 5,000 patients that have worn this brace in over 15 years, about 90% of them were able to successfully avoid surgery. And this was if they met or exceeded the wear time of the brace, which is going to be important to tell our patients. Within those 90% that avoided surgery, about 60% of those curves were stabilized, while 30% of the curves improved and actually decreased in Cobb angle. And not only are you getting a lateral correction with this brace, you're going to get rotational and sagittal curvature corrections for an overall 3D correction of the spine. And because of the open design and lightweight material that this brace offers, the patient is going to have increased tolerance to wear it throughout the day. Next, in terms of how to assess patient benefits, we really want to monitor for stability or reduction in the scoliosis curve progression. And this is going to be done mainly by performing serial x-rays, which is actually the gold standard for monitoring scoliosis curves. Before a patient gets a scoliosis brace, they will get x-rays just as a baseline to see where they're at, and every 4 to 6 months afterwards we're going to be getting x-rays again just to check and make sure that the brace is actually doing its job and either stabilizing the curve or improving it. And success with these types of braces is going to be defined as a curve that has not progressed by 6 or more degrees. We're also going to do a physical assessment of the Rigo Cheneau's fit. We want to assess the patient's posture, their shoulder and pelvic alignment, and skin checks just to make sure that the brace is not rubbing in any spots it's not supposed to and is not uncomfortable for the patient, and that's actually providing the most benefit for them. We're also going to check in with the patient on their compliance with wearing their brace. We know that an increased wear time is going to have improved results for the patient, and that's going to be something that we really need to let them know. And lastly, we want to check and make sure that the patient is getting pain reduction by wearing the brace. And again, by assessing the fit to make sure it's not rubbing in any unwanted places or causing any further damage. And we want to make sure that the patient is able to breathe okay with the brace on.
When looking at a custom made TLSO, some important considerations with the Rigo Cheneau model is its cost and overall feasibility. Because it is completely custom made for each child's specific spinal curve, which addresses their rotational components of how their scoliotic spine moves, it is significantly more expensive than something standard off the shelf brace that you may see. Research was varied, but usual cost ranged from about $4,000 to $8,000 or more, up to about $15,000, depending on the provider and location. Also, insurance coverage can vary widely, and some families also have to face substantial out-of-pocket expenses. In addition, this brace requires a specialized orthotist who is trained in the Rigo Cheneau method. Therefore, not all regions have providers with this expertise, which could also limit access and may require families to travel. Finally, treatment isn't just a one-time cost, especially with children, and how they need ongoing follow-ups for monitoring and adjustments, and as they grow, they may require replacement braces.
In addition to cost and feasibility, there are other limitations to the Rigo Cheneau brace, most notably difficulties with compliance. For maximum effectiveness in preventing further spinal curvature, the brace has to be worn nearly full time, often between 15 and 23 hours a day. Teenagers especially can be resistant to wearing the brace full time, making it more difficult for the brace to be truly effective in preventing surgery. Skin irritation and discomfort is a common complaint during use of the brace. Although it is custom made to create areas of low pressure, constant use can still create skin irritation and sometimes even blisters. As children grow older, they can often outgrow their brace. This requires adjustments to be made to the original brace, or sometimes an entirely new brace has to be fitted to ensure its effectiveness. Considering the cost of these custom-made braces, this is not always feasible for some families. Finally, wearing the Rigo Cheneau brace has an emotional and lifestyle impact on kids who wear it, especially teens. Kids may not be able to do certain activities because of the near full-time wear schedule for this brace. Unfortunately, there is also often a stigma associated with the use of orthotics, and kids using these braces may face judgment from their peers.
Thank you for watching this introduction of the Rigo Cheneau brace. Here are our references, and please let us know if you have any questions.